Hello everyone, I'm Dr. Chai. I'm a board certified pediatrician and a neonatal fellow in training. I'm posting detailed videos about how to be a doctor in the US. I'm also posting content about common diseases in children and pregnant mothers. Why USA? According to 2024 World Population Review, Switzerland tops the world in paying the highest amount of salary to physicians with a whopping amount of $388K per annum. Second in place is the USA with an amount of $316K per annum. Third in place is Canada with pay of $200K per annum, followed by Europe, which is up to $100K per annum. This is an average salary irrespective of your specialty. If you end up going to ICU, emergency medicine, or surgical specialties, you will end up making double or triple of that amount. Not to mention, USA has some of the top-notch hospitals with cutting-edge research opportunities. Road for international doctors in USA is easy if you follow the right materials and timeline. There are 3 exams you need to pass after your MBBS to obtain post-graduation or residency in the USA. Step 1 is a basic science exam. Step 2, clinical knowledge, or Step 2 CK, is a preclinical exam. Step 3 is a mix of both the materials with emphasis on clinical scenarios. All the information about STEP exams will be in my caption. Step 1 syllabus. The syllabus for Step 1 exams is mostly what you study in first and second year of your MBBS, like anatomy, biochemistry, physiology, pathology, microbiology, and pharmacology. Overall, it concentrates on the pathophysiology of the diseases. Message me Step 1 syllabus and I will DM you the system-wise syllabus in a PDF. Step 1 study materials. People use First Aid, UWorld, Kaplan Series, Pathoma, and Sketchy Micro. These are the most commonly used study materials. But if you want recommendations on which specific books to read for specific chapters, message me Step 1 study and I will send it to you directly. Step 1 timeline. Many people take 6 months to 14 months to ace this exam. I took around 8.5 months. I started with 4 to 5 hours of study per day to a maximum of 12 to 14 hours later in my study period. The best time to take this exam is when you have a dedicated holiday prior to starting your internship. Some people also take after they finish their second year of MBBS, but it can be a challenge if you're also studying for your third year exams. So I would recommend you can either take it prior to starting internship, or if you have completed internship, you can study with the dedicated time period in that time. Step 1 eligibility. Medical students or graduates who are enrolled or graduated from US or Canadian medical school automatically are eligible for this exam. However, we being international medical graduates, our school must be registered from World Directory of Medical Schools, and you should be a graduate or currently studying in that school. Check in my caption if your college or medical school is enrolled in the World Directory. Step 1 format. It's an 8-hour-long exam with a 7 60-minute block. There is a 45-minute break in between, and there's an optional 15-minute tutorials at the beginning of the exam. Each block can vary in number, but do not exceed 40, with the overall number of questions is up to 280. The link for Step 1 exams overview can be found in my caption.